All right. And thank you all for joining today. My name is Micheline. I am working with Mendocino Health Alliance as the executive director. And we are a community-based organization that provides a variety of services like health screenings in the community, care coordination for people who need help navigating their health care, or other resources like transportation, medications, durable medical equipment, and other things. And we also do a lot of prevention work in the community. And this is one of those things that we do, the Narcan training regularly. And we work with Emily Peterson, who is a pharmacist, and she will be presenting to you today. So I just want to give you a heads up throughout this process. We will be launching a few polls, which are anonymous, and we ask that you complete them just to help us learn about how well we're delivering information and how you're learning about our programs and workshops. And in addition, we do have a chat box available. So if there are questions throughout the process, please feel free to ask in the chat box. And at the end of the presentation, Emily will be able to address any questions that you might have. So without further ado, I will hand it over to Emily to take over. Thank you, Emily.
Thank you. Good afternoon, everybody. My name is Emily Peterson. I am a pharmacist, and I work here within the community. Today, I'm going to be presenting on learning how to save a life, the ins and outs of opioids and overdose. And we've put this presentation together in collaboration with Mendocino Health Alliance. So you may be asking, why here? Why now? Why at this point are we having a conversation? So I've been practicing in pharmacy about 16 years, and a little bit more about myself. I've worked in multiple different roles throughout this time, from a pharmacy clerk, where I started my early career in pharmacy, to a pharmacist working in retail and hospital pharmacy in the community. I'm a fourth generation in my family to be raised here on the northern Sonoma Coast region. And one of my greatest aspirations or goals in pursuing a career in pharmacy was really to be able to become an educator for my community and an advocate for the health of this community that is so near and dear to my heart. So throughout my career, I've encountered many individuals and had hundreds of conversations about prescription opioid medications, their side effects, potential risks, and in particular, if they are not used correctly or as intended. And prescription opioids, in many cases, play an essential role in the treatment of pain, sometimes acute pain, for example, after you've had a surgery, and sometimes more chronic conditions in which they're needed for longer term or longer course. I've worked with individuals who are concerned about taking opioids for post-surgery pain because they were concerned about, becoming an addict. And I've worked with individuals requesting help because they felt they may be becoming dependent on their opioid prescriptions. I've participated in caring for individuals that have unfortunately overdosed and others that have become involved in illicit substance and opioid dependency, where they were faced with very critical health conditions. And so based on my experience and my desire to be an advocate for health in our community and be an educator, and as a pharmacist in this community, I believe I have a responsibility to try to help educate and raise awareness about opioids and the life-saving reversal called Naloxone. And so to break down these barriers and to improve access to treatment and care, and hopefully help others save lives if you were to encounter someone overdosing from opioids. So today, we are going to be talking about a few different items, and by the end of today's presentation, the goal is that each of you will feel confident with understanding the term stigma, defining opioid and Narcan or Naloxone, understanding the causes of an opioid overdose, recognizing the signs of an overdose, understanding how to use intranasal Narcan or Naloxone, learning the critical steps in safely responding to an overdose situation, and reporting reversal. It is anonymous, but it is very critical to report it so we understand how it's being used in our community, how often it's being used in our community, and hopefully being able to dedicate additional resources and services, if we're seeing that there's a trend. So we've really seen 3 different waves of the rise in opioid overdose deaths. And this graph here really, illustrates that. And I'm sorry, Micheline, I think I forgot one of the polls already.
Not a problem. I will go ahead and launch it right now. Thank you for doing that. Oh,
want me to go back one?
No, you actually have not forgotten one.
Okay.
Yeah, you're good.
Okay. So with the rise in opioid overdose deaths, we really saw the first kind of wave starting in 1999. And this is when we saw prescription opioid overdose deaths. So we saw a pretty dramatic increase in commonly prescribed opioids that were unfortunately causing opioid overdose deaths. In 2010, we saw a large rise in heroin overdose deaths. So heroin is also an opioid, and we saw a big rise in heroin making it into the communities. And wave 3 was really in 2013 when we started seeing other synthetic opioids. And by other synthetic opioids, I'm talking about tramadol and fentanyl. So these could be prescribed legally or illicitly manufactured. And unfortunately, especially as it pertains to fentanyl, we now are seeing a huge trend in illicitly manufactured fentanyl making its way into counterfeit pills on the streets and that are not prescribed. And also, fentanyl is being used to lace other illicit substances. So that's a little bit of background. Nationally, looking at the data, overdoses involving opioids killed nearly 47,000 people in 2019, and 32% of those deaths involved prescription opioids. And in 2019, overdoses involving opioids killed nearly 50,000 people, and over 70% involved in opioid. If you think about how that averages out, it's about 40 deaths per day with opioid-involved overdoses. And since 1999, overdose deaths involving opioids have increased 6 times. So we did see a decrease in opioid-related overdoses reported between 2017 and 2018 nationally. The impact of COVID-19 pandemic has led to an increased reports of opioid-related overdoses. And the opioid epidemic, is extremely far-reaching, impacting communities all around us of various age, gender, race, education, socioeconomic levels. This opioid pandemic that we've seen, opioid epidemic, really does not discriminate. So within our community, this data is related to our more direct community instead of nationally. But in 2016, Point Arena, California had the highest opioid-related overdose death rate per capita in the county and the state. And Gualala in 2019 had the highest opioid-related overdose death rate per capita in the county and the state. Gualala also ranked the second highest in opioid prescriptions per capita in the state at 982 prescriptions per 1,000 residents. And Point Arena ranked third highest at 972 per 1,000 residents. Now, keep in mind that is per capita data, so it could mean that some individuals have no prescriptions for opioids and other individuals have several prescriptions for opioids. It's estimated that about 12% of the population in our area struggles with addiction compared to the California state average of 8.5 compared to 7.2% nationally. And when we talk to middle schoolers and high schoolers, 15.3% reported taking a prescription medication not prescribed to them. And 87% of students surveyed reported parents or teachers seldomly or never talk to them about the dangers of substance abuse. And so when we look at the rate of opioid overdose deaths in Mendocino County, it is actually 3 times more than the rate for California as a whole, which is why I think it's so important that we talk about about opioids and how we can potentially save lives with the use of Narcan. I want to take a minute to talk a little bit about stigma. So to kind of define stigma a little bit more, it's really in terms of a mark of disgrace associated with a particular circumstance, quality, or person. It detracts from the character or reputation and creates labels and stereotypes. It creates negative beliefs or attitudes towards others, and ultimately creates inequality in the way that we treat others. And there is a huge stigma around opioids, around substance abuse, around addiction. And in order to take the first steps in introducing services and people being open to hearing education and putting these types of resources into our community, we really need to work on reducing the stigma. So I'm going to play the Overcoming Addiction video that was put together by Mendocino Health Alliance.
Here are just a few of the benefits of training your pelvic floor muscles. Stop leaking accidents.
We are in Northern California, and it is beautiful here, and we have dealt with the same thing that everyone else is dealing with: racism, health inequities. Homelessness is high, people are out of jobs, and substance abuse is really affecting our entire community.
Studies have shown that approximately 60% of addiction is genetic predisposition. So there are many triggering factors that can lead to addiction. People suffer from depression, or simply people suffer from other psychiatric disorder, put them at higher risk for addiction. Prescribed opioid medication is another gateway, and of course, environment can also be a factor.
Isolation is a big part of addiction here. This community is, a lot of us are like spread out, and they use alcohol and other drugs to cope.
Emily, your screen switched.
Okay.
I became addicted to opioids after having spinal surgery, and I started taking medication as a result for the pain, and was addicted to them in total for a year and a half. I thought stopping the drugs would be easy once I decided I was going to, and I was having physical reactions that I could see and feel when I wasn't getting the drugs. So it was harder than I thought.
By the time I was 12 or 13, I was smoking meth with my mom, and I was using every day after that, and it was really hard to imagine having a day without being high. And I went through several different foster homes my last year and a half of high school, and the last home I was in were foster parents who were a little bit hippie, a little bit rock and roll, and without their unflinching love, especially in the light of my most awful behavior, I honestly think that I may have killed myself, either accidentally or otherwise. My life today is such an incredible miracle, and it is never lost on me. I'm in my 27th year of recovery, and there are still some days where I stand at my kitchen window and I look outside my backyard, and I'm struck with disbelief that I live in a safe home with my sons who are safe, who have everything they need, who have never seen me loaded. My life is incredible.
Many people experiencing addiction do not seek help because they feel shame about their addiction, and they're concerned about being judged by their friends and their family or the general community. So it really, stigma surrounding addiction and it being their fault prevents them from getting the help that they need.
Oftentimes, stigma becomes a barrier. So if we want to see a successful outcome, we have to start from there. Our role here in our community is really to educate everybody more about what is addiction. We need to let people know that the earlier that we can start the intervention, the better outcome that we are going to see.
Freshman year, high school, I got caught smoking marijuana on campus by like our favorite teacher, so that was pretty shameful. I got expelled from the school, so I went into depression. I got back into school, played sports, but I still drank, I still smoked, and then I think eventually I used meth. One night at Overdose, that really took me really by surprise. It really woke me up to realize that I could have lost my life, and it really helped me realize that I need to stop abusing myself. My body, my spirit was telling me that I have a bigger purpose to serve. To be able to recover here in my own community at home was the best thing, because it really opened my eyes to what the true meaning of being a community member, being a family member, being a friend, being a husband really means. The life that I live today is amazing. I'm thankful to be able to experience fatherhood, be able to experience being married for almost 12 years. My mind and my heart is open. I feel connected. Through recovery, that's possible.
If you're a loved one of somebody who's struggling with addiction, I think one of the first steps to do is reach out. Let that person know that they're loved and cared for, and let them know that you're not going to judge them for the choices they've made in their path. When someone is ready to ask for help, there are definitely resources in our area. And with Mendocino Health Alliance, we can help you get connected to those services. It can be online, it can be in person. We're here to help.
If you're a person experiencing addiction, I want you to know that you're not alone. Mendocino Health Alliance is more than ready to help you find the resources to jump those obstacles that are in front of you.
Addiction is not a choice, and it doesn't define people.
Como hablamos de las personas que usan drogas, importa.
I am not my addiction.
We can overcome addiction
Together.
Right. I'm so sorry about that little glitch where you could not see the video, but here we are with technology. So just a really remarkable compilation, identifying how we really need to break down the barriers, reduce the stigma, and open up the pathway for people to seek resources and support, and bringing the resources necessary into our communities to really help with addiction. So I'm going to transition into a little bit of discussion about opioids, because there is some terminology that I think is important to understand when we talk about opioids. There are natural, semi-synthetic, and synthetic opioids. And when we talk about opiates, opiates are really opium or derivatives of opium, which are naturally occurring from opium poppy. And natural opioids are morphine and codeine. So they are the primary active components of opium. Semi-synthetic medications, on the other hand, are created from naturally occurring opium products, such as morphine and codeine. And then they are somehow changed slightly chemically and produced into semi-synthetic components. So these are oxycodone, hydrocodone, hydromorphone, and oxymorphone. Heroin is also processed from morphine and extracted from certain poppy plants. So heroin is an opioid, but it is considered a semi-synthetic opioid because it does go through a process where it is changed in some way. Synthetic opioids, on the other hand, are completely made in a laboratory, and they're designed to have a chemical structure like opioids. So they look the same to our bodies, and those are fentanyl, methadone, and tramadol. So I'm going to introduce a few of the different types of opioids, and then also attached to them are some the brand names and also some of kind of the street terms or slang names that you may encounter or hear. This is important because when you are talking to somebody, or if somebody is telling you, oh, I've got some bananas that, I'm going to take tonight or whatnot, it's important that we all kind of understand what the different terms could potentially be for these medications, so we understand what others are maybe talking about, and we can provide support and help if needed. So fentanyl is the generic name, and Actique or Sublimase is the brand name of fentanyl. And those are a few street names there. So you see the Goodfella, the Jackpot, the Murder 8, China Girl, Crash, TNT. Hydrocodone is the generic for Norco, Vicodin, or Lortab. And those were really seen, especially in that original kind of rising wave of opioid prescribing, with a lot of the Vicodin, the Norco, the Lortab. So these are the bananas, the hydros, the tabs, the Vikes, the vitamins, so to say. Hydromorphone or Dilaudid, those can sometimes be referred to as footballs or dillies or smack. Oxycodone, there's Oxycontin, which is an extended release formulation, which acts much longer in the body. And then there's the more immediate acting version as well. And then there's also Percocet, which is the combination of oxycodone and acetaminophen or Tylenol. So you can see the various different names there. Morphine, so again, there's Duromorph, there's MS Cotton, which is the extended release morphine product, sometimes referred to on the street as monkeys or morphos. Methadone, and that one goes by the brand name of Dolafine or Methadose. And then heroin, and so oftentimes referred to as black tar, black pearl, number 8. So that's just to give you a little bit more context. So I wanted to talk a little bit about how opioids affect the brain and how they work in the brain. So within the normal brain that you see there on the left-hand side, we have these little these little things here that we call opioid receptors, and those are on the outside of cells throughout our bodies, and they react with our central nervous system, and they tell our bodies to do different things and exhibit different responses. And so we have these opioid receptors that are naturally occurring in our bodies, and endorphins are naturally occurring in our bodies, and there are certain endorphins that attach to these little receptor sites. So those blue little dots there connect to the opioid receptor, and once they do that, then there's a stimulation of our system, and there's the release of dopamine, which cascades a response of our reward system. Opioids interact with opioid receptors on nerve cells in the body and brain, similarly to how these endorphins interact with our opioid receptors. However, opioids are intended to relieve pain, and sometimes acute, sometimes chronic. So here on the right side of the screen, you can see these same little receptors, but now these red opioids are attaching. And when this happens, it can cause an excessive stimulation of the dopamine reward system, which causes us to have a relief of the pain that we're experiencing. And sometimes also unintended side effects, including a sensation of pleasure or happiness, and a feeling of euphoria, which sometimes can lead to the excessive stimulation of the dopamine reward system. And sometimes people associate opioids with those feelings, so it's not only relieving pain, but it's also producing that sense of euphoria. Over time, as we continue to use opioids, our bodies become less responsive to the dose that we've been taking, and this oftentimes leads to an escalation or increased dose needed in order to produce the same effects, whether it be to relieve the pain that we're having or to cause that sense of euphoria, if someone were to be using opioids more so for that purpose. So when opioids are being used illicitly, the escalation of doses or more frequent doses are needed to produce the same feeling or release of pain. So side effects of opioids, some of the common side effects are upset stomach, or sometimes it will make you so nauseous that you're throwing up. It can cause dizziness, and the sensation of pleasure or happiness or drowsiness is actually a common side effect of opioid medications. Additionally, dry mouth and constipation. So it can cause you to feel sleepy, it can cause you to feel pretty relaxed. When we talk about the serious side effects, include slow or shallow breathing, because opioids do affect the way that your body responds to the need to breathe. Trouble breathing, confusion, vision changes, and sometimes loss of consciousness or passing out. And so over time, if we are increasing our dose intentionally or intentionally, because we certainly do have seen cases where an individual takes a dose as prescribed, and then a couple hours later they can't remember, did I take a dose, did I not take a dose, I take another dose, or maybe my pills get mixed up and I inadvertently take another dose, and now you've just taken 2 times the dose that you were prescribed. And so as you increase the dose that you're taking, especially for somebody who is not has not been taking opioids before, this is where you start having an increased risk of those serious side effects that I talked about. Okay. Likewise, when you think about a person who is, potentially using methamphetamine or cocaine, unfortunately, fentanyl is being used to lace some of these drugs, and fentanyl is also being used in counterfeit pills. And so if an individual doesn't realize that what they're taking has been laced with fentanyl, that could very quickly cause such a high dose for somebody that their risk is exponentially or significantly increased to having these very serious side effects. And those serious side effects are where we start talking about the signs of a potential opioid overdose. So the signs of an opioid overdose are extremely important to understand when you are making an assessment, or if you know that somebody may be using and you're concerned about a potential overdose. So some of the signs include blue lips or nails, dizziness or confusion, maybe they're slurring their speech, you can't really understand them, they look a little bit, confused and kind of dazed, not really with it. If they're unresponsive, or they could be sleeping, but you cannot wake them up. So, you pick their foot a little bit and they're just not responsive. If you're really concerned, you can give them kind of a stern rub on their sternum, and, they're not waking up, they're not responsive. You may hear choking or gurgling or snoring sounds in somebody who's, you're not otherwise able to wake up. They may be slow, have a weak or no breathing at all. If you find somebody who's just, taking kind of a gasp here and there, or no breathing, or sometimes even drowsiness or difficulty staying awake. So they're just not able to keep their level of consciousness. People can become kind of clammy, so like clammy skin. And really, once you start seeing these signs of overdose, it's so important to act quickly. The reason for that is because as you stop breathing, or as an individual is not able to get the oxygen that they need, the carbon dioxide levels increase, and the oxygen levels end up decreasing, which leads to brain injury. So recognizing that, fentanyl is being added to methamphetamine and other counterfeit pills on the market, it's so important to understand that if you suspect somebody is overdosing or could have overdosed potentially, it's really important to take action right away. So when we talk about emergency response, it is critical, and time and response are really the difference between life and death in an opioid overdose case. I want to just make mention that California's AB 1535 and the 911 Good Samaritan Law support the expanded access to naloxone and encourage people to call for emergency assistance at the scene of an overdose without fear of being arrested or being prosecuted, because it is just so critical to treat an opioid overdose as soon as possible to prevent death. So number one, you want to call 911. You always want to call 911 right away because it's going to take time for emergency response to get to the scene. Number two is if you have it available or if somebody has it on them, you want to administer the intranasal Narcan. And after you've administered the intranasal Narcan, you'll want to put the person in the recovery position. So they're on their side and their hand is used to support their head. Their knee is kind of placed over their body to prevent them from rolling back over just in case they are to vomit. You don't want it to block their airway. You want to continue to stay with the person. So you never want to administer intranasal Narcan and then leave the scene. You always want to stay with the person and monitor their response. And there are instances if within 5 minutes, 3 to 5 minutes, you don't see any response, it would be appropriate to administer another dose of intranasal Narcan. Okay. So number one, call 911. Number two, use intranasal Narcan. Number three, make sure to stay with the individual and monitor them.
Emily, can I launch a poll real quickly?
Yes, please.
Awesome, thank you. It's a 3-question poll, and I will do that right now. So everybody should be able to see that on their screen, and we'll give everybody about a minute or two to finish up. Responses are rolling in. Looks like we have almost everybody. So with the first one, true or false, heroin, Oxycontin, and fentanyl are all examples of opioids. 92% of people said true, 8% of people said false. Do you want to address that, Emily?
Yeah, sure. So heroin, Oxycontin, and fentanyl are all examples of opioids. They're examples of some of the different types that we talked about. So with the heroin being that semi-synthetic, so it is derived from morphine, and morphine is an opioid. And then the fentanyl is a synthetic opioid, which is produced and unfortunately being used to lace or being added to methamphetamine, sometimes even cocaine, and also a lot of the illicit or counterfeit pills that we are seeing ending up in our communities.
All right, thank you. And number two, every 100% of people got correct. It said, what are the signs of a possible opioid overdose? And the response is nodding off, can't wake up, blue lips, clammy skin, etc. And number three, naloxone is also known as, 92% of people got this correct. They said Narcan, which is absolutely right. So somebody else responded as tramadol. Tramadol is actually a form of an opioid. So naloxone is also known as Narcan. Okay, go ahead.
Okay, so I'll talk a little bit about what Narcan or naloxone is, now that I've introduced it in the pathway of responding to an overdose. So Narcan is the brand name of the prescription drug naloxone. And we are going to be talking about the nasal spray today, although it is also available in an injectable form, which we use more so in hospital type environment or emergency department or first responders. And Narcan or naloxone is used to rapidly reverse the effects of an overdose from opioid drugs. And so as soon as you've administered that first dose of naloxone or Narcan intranasally, the hope would be that the person starts responding really within a couple of minutes. And if you're not seeing a response within the 3 to 5 minute range, then it would be appropriate to administer a follow-up dose. With what we've seen, especially with the fentanyl, fentanyl is a very high potency, meaning it's highly concentrated, and it takes very, very small amounts to cause significant harm or the respiratory depression. And so in some cases, if somebody has taken a lot of an opioid, in particular fentanyl, it can take several doses of the Narcan in order to start reversing the effects of the overdose. And so the reason that it's, again, so important to call 911 right away is because oftentimes an individual will require several additional doses ongoing until the body has been able to fully eliminate the opioid. And so the ongoing use of Narcan is often needed even past the initial first 1 or 2 doses. So I'm going to talk about how Narcan or naloxone spray works. So naloxone actually works to reverse an overdose by blocking the opioids from getting and attaching on to these opioid receptors. So you remember we talked about receptors, opioid receptors, and they looked a little bit different in the last slide. So this is an opioid that is attached. So those little pink dots are opioids that are attached to an opioid receptor. And naloxone, this green kind of bubbly image, comes in and actually bumps the opioid off of this receptor so that it reverses the effects. And so when it bumps it off, it can act for about 30 to 90 minutes in that spot, which gives the body time to start eliminating the opioid. And this allows the person to breathe again and reverse the effects of the overdose. And I did mention that sometimes a second dose may be and is often required. I think we have another poll, Micheline, correct?
We do. Okay, thank you. All right, poll number 2. Here we go. This is 3 questions. All right, responses are starting to roll in. All right, keep sending in those responses. As we talk so far, number 1, true or false. If the individual is revived using Narcan, you should stay with the individual until help arrives. 100% of people have said true, and that is absolutely correct. Number 2, true or false. Narcan, also known as naloxone, can be used to reverse a benzodiazepine overdose, such as Xanax, Valium. And we have 30% of people saying true and 70% of people saying false. Emily, would you like to speak to that?
Yeah, absolutely. That's a great poll question and something I need to make sure to mention. So Narcan or naloxone is very specific to opioid overdose. So if an individual has used Ativan or Xanax or overdosed on another medication other than an opioid, Narcan will not actually work to reverse the effects of that medication. And the reason for that is because the naloxone specifically attaches to that little opioid receptor in the brain. And other medications such as benzodiazepines, they attach to different types of receptors. So naloxone is very specific to overdose for opioids. And I will say, though, that if you don't know what somebody has overdosed from, and you suspect that it's an opioid overdose or could be, it is much better to treat them with naloxone than risk not treating them and having them die. So if you use naloxone and the person did not overdose on an opioid, it will not cause any harm to them. So just keep that in mind.
Awesome. And the last one was true or false. Substance use disorder is a prevalent, treatable chronic illness. 100% of people said true, and that is absolutely correct. Thank you, everybody.
Right, so the use of intranasal Narcan or Naloxone administration is extremely simple. I'm going to show you just a brief video on here, but I definitely encourage and highly recommend that you review the instructions for use and familiarize yourself with the Narcan nasal spray in advance. Because we all know that when we're in that stressful situation or that stressful moment, we don't want to have to be fumbling with it and learning how to use it. It's best to know how to use it. So I highly encourage everybody to review that. So the key steps are that you, the little box, it comes with 2 intranasal Narcan administration devices. And so you just take one of them, you peel back the cover, you hold the device with your thumb at the bottom of the red and your 2 fingers on the nozzle. You place the tip of it deep into the patient's nostril, and you push with the bottom with your thumb up to release the spray into the nose. And that's what you do. So I'm gonna play this brief video, and I will.
I'm a pharmacist, and today I'd like to go over how to use your Naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about Naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your Naloxone. Now what? This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
I think it's always great to see a video of somebody doing it or reenacting it versus just looking at a few steps. So hopefully everybody found that helpful. Just to reiterate, you want to remember that after you administer that intranasal Narcan, that you want to put the person back in the recovery position on their side so that in case they do throw up, then their airway is not blocked. And additionally, if you administer Narcan, like I spoke about, to somebody who didn't overdose on an opioid, it's not going to harm them. And you're not going to get in trouble if they're not overdosing and you administer it. The risk of death for someone who is overdosing on opioids is much worse than the risk of having, a potential reaction or no reaction at all to Narcan. So I wanted to revisit the question, why here, why now? Because I think it's important to just kind of circle back on our discussions about the abundance of opioids in our communities. We face, really a critical state, and it's so important that we eliminate the stigma associated with opioids and even naloxone. I've had a lot of conversations with patients who we've prescribed naloxone to because they are on a higher dose of opioids, and it's important that they just have the Narcan with them or in their possession so that in case something does happen and they maybe do, unknowingly or forget that they took their dose already and take another dose, that they have Narcan on hand. And Narcan also carries a stigma sometimes in that people think that you're accusing them of abusing the opioid, when really that's not the intent. The intent is that we want naloxone available in our communities as a safety measure. So, additionally, recognizing the signs of an opioid overdose quickly, requesting emergency assistance and administering intranasal Narcan. So remember, you want to call 911 after you've recognized the symptoms of an opioid overdose. You want to request that emergency assistance, and then you don't want to waste any time in administering intranasal Narcan. And then finally, staying with the individual, placing them into that recovery position, and waiting with them until help arrives. If you don't see a response after 3 to 5 minutes, you can definitely administer that second dose into the other nostril. And then lastly, I hope that we can continue to educate and share what you've learned and what you've taken away with others around you. Together, we can do much more, and together we will save lives by educating each other and educating our community. So I wanted to recap with what are some examples of opioids. So we talked about the morphine or MS cotton, codeine, hydromorphone, oxycodone, oxycontin, hydrocodone, methadone, codeine, and fentanyl. And keeping in mind, we have the different synthetic, semi-synthetic, and the more natural occurring morphine. What does stigma mean? So just reiterating there, we talked about it being really detracting from one's character or reputation and being a mark of disgrace. It creates inequality and negativity, and what it means to really break down those barriers and reduce the stigma around opioids, around addiction, and allow an opportunity to improve the health of our communities. What are the signs of an opioid overdose? Remember, the blue lips or nails, dizziness or confusion, someone just doesn't really seem with it. They have slowed breathing or maybe not breathing at all. They can't easily be woken up. They're having a hard time staying awake. These are all really critical signs of opioid overdose, and when you would want to definitely call 911, administer the intranasal Narcan if you have it, and then stay with the individual until help arrives. How can you respond to an opioid overdose? So I just reiterated that again, the important steps. And just keeping in mind, I briefly talked about it, but oftentimes when somebody overdoses on an opioid, it takes multiple doses of Narcan until the effects of the opioid wears off. So the Narcan is not getting rid of the opioid in somebody's body. It's just allowing the body time to get rid of it. And so you oftentimes need to continue to administer more Narcan so that the Narcan can continue to bump the opioids off those receptors and allow the individual to stay responsive and remain breathing. Here's a recap on the steps to administer the intranasal Narcan. So you peel back the package, you hold it between your 2 fingers and your thumb, and then you place it firmly into the individual's nostril, creating a little bit of a tight seal, and then you press the bottom plunger with your thumb so that it sprays into the individual's nose. If you need to administer the second dose after 3 to 5 minutes, you would administer it into the second nostril using the same process. And why is it important to anonymously report the use of naloxone? Like we talked a little bit about, it really helps to identify what communities may need resources and support based on where we're seeing the utilization. It helps track if the naloxone that is being distributed in our community is being used and is of value. It may help with funding of additional services in our communities, including emergency response. So we know that living in a rural area, it can take a while for our emergency responders to get to the scene of an emergency. And so having this available throughout our communities based on where we live in a more rural environment is really, really important to having it available when we need it and allowing time for our first responders to respond. And I think we have one more poll.
We do,
as
thank
we
you.
Close it up. Okay.
And then after this poll, we do have a number of really great questions that people have asked. So this poll is 5 questions long, and it's more about your feelings about what you've learned today. So it's anonymous. Please provide honest feedback. All right, we have responses coming in. And while that's happening, I'm going to put in the chat box to everybody. Narcan can be provided to anybody who's completed this training today for free through Mendocino Health Alliance. If you are interested in receiving free Narcan, please send an email to info@mendocinohealth.org. I just put that email in the chat box to everybody. And what I ask you to do is in the subject line, just put Narcan training. And then in the content of the email, please just include that you completed the training with Emily today and that you would like a box of Narcan. And then we will coordinate with you whether you want to pick it up in our office or we can mail it to you. Either one will work for us. So I'm going to go ahead. Looks like we have the responses. I'm going to end the poll. Thank you so much. And then the other thing I want to offer everybody is we have a number of workshops, education classes, and a variety of services available that we often advertise through our email list. So for anybody who is interested in getting on our email list, I'm going to put a link in the chat box. If you click on that, you can register to get on our email list, and that will provide you with all of our upcoming events and educational opportunities, which all of our services are free. So, and now that everybody's closed up the poll, Emily, we have a few minutes left, and I just want to go back through and get some of these questions answered that people had. So the first one is, why are some drugs on the street cut with fentanyl?
That's a great question. So when we talk about cutting drugs with fentanyl, there's various different reasons that that drugs are cut. Sometimes it's to increase the volume that they have so that, you know, you end up having more supply that can then be sold and they make more money on it. So sometimes they're cut not just with fentanyl, but with other, you know, byproducts and things. But more specifically, fentanyl is usually used to produce a stronger response. So when you look at counterfeit pills, for example, so counterfeit pills are cut sometimes with fentanyl. And so when you have counterfeit pills, they can look just like, you know, a Vicodin tablet that you would be prescribed potentially. But if they cut it with fentanyl, it may not even, it's not really even hydrocodone or Vicodin. If they're cutting it with fentanyl, they're trying to elicit the same response by adding the fentanyl to it. If they're, what we've seen now is that fentanyl is being even added to methamphetamine or even cocaine. So it's being used in combination with stimulants. And it's really to, you know, produce kind of a, what I've read about is a more balanced type of high in some respects. So you have the stimulant, which is then balanced by the relaxant and helps with kind of that coming down period. So there's a variety of different reasons that fentanyl would be used to be cut or lace other drugs. Hopefully that answers your question.
Yeah, and I would just add that the danger of that is when you're not the one actually adding the fentanyl, or if you don't have experience with the amount of fentanyl that is in the pill, that's what's dangerous, is you're taking something that you actually don't know its potency.
Yeah, absolutely. And likewise, if an individual doesn't even know that fentanyl is in it, and they've maybe never even taken opioid consistently in their life, their risk of an overdose is extremely high because of the potency of fentanyl. And that's where, unfortunately, a lot of overdoses occur, is sometimes unknowingly that fentanyl is in these products, and there's no way of knowing how much fentanyl is in there.
Thank you. The next one is, are the opioid receptors actually dopamine receptors?
Great question, and apologies if that was a little bit confusing. So opioid receptors are not dopamine receptors. So our bodies produce different endorphins, which look like, or opioids are made to look like endorphins. And endorphins attach to those opioid receptors naturally in our body. The response that occurs when that happens is that dopamine is released. So dopamine is actually what is released, which causes the relief of pain or the sense of pleasure or happiness. Dopamine is released in various different instances in our body, which causes pleasure, happiness, relief of pain.
Thank you. Our next one is, how long do you wait before administering the second dose of naloxone? And how obvious is it that it is working?
That's a really great question. So the recommendation is a little bit different depending on what resources you look. So some say 5 minutes, others say 3 minutes or so. 3 to 5 minutes is a reasonable time frame. What you would generally see with an individual who is starting to have a response is that you would notice that they are able to regain some level of consciousness or breathing. So for somebody who may be overdosing, but is not to the extreme kind of overdose point yet, they may actually kind of become more alert and oriented. So if somebody is really not breathing, you would hopefully start seeing the signs that they are that their breaths are not as shallow, or that they're able to take a stronger breath, that their breaths become more frequent. So you would want to look for those types of signs.
Thank you. We have just a couple more. Is Narcan absorbed through the mucous membrane in the case of persons not breathing?
Yes, it is absorbed through the mucous membranes, specifically in the nose, which is why we're administering intranasally. So it does get absorbed through the mucous membranes, and that is how it's getting into the bloodstream in order to block the opioid from attaching to the opioid receptor, and therefore reversing the effects of the opioid overdose. So in a patient, in an individual who's not breathing, the Narcan intranasal is still absorbed.
Great. Okay, so then our next question is, if a person has some signs of an overdose, but they are unable to, but let me reread that. If a person has some of the signs of an overdose, but they are able to communicate with you, should you just wait and see what happens?
That's a good question. So I think it probably depends on the level of communication, right? So when we're talking about somebody who may be going in the early stages of overdose, maybe they're still, semi-coherent, and you're not quite sure. If you don't treat, right, if you ask the individual and they say, no, I'm not overdosing, then you really wouldn't want to, obviously force upon like giving them Narcan. If the individual is not quite sure, and maybe, did you take an extra pill or something like that, and the individual is open to it and saying, I just don't feel right, like something isn't right, if they're able to communicate like that, then yes, it would probably be appropriate. If you're really not sure and the person is more resistant and, just kind of like, no, leave me alone, I'm good, like this is where I want to be right now, I would definitely recommend staying with them and keeping an eye on them, because chances are, if it's, if they're unsure if they're overdosing, if it's not intentional, and maybe they're just kind of, getting a high at that point, I would recommend staying with them because it can quickly escalate. And so should they become unresponsive, their breathing slows down, they appear to be going into a state of overdose, then you would want to be there to administer the Narcan. I hope that answers the question.
Thank you, Emily. And something we tell people when we do just in-person trainings is that if there's a question at all and the person seems like they're overdosing, if they have these symptoms, even if you're not sure if it's related to opioids, Narcan it's not harmful in any way, shape, or form. So if you administer it as a just in case type solution, it's okay. It's not going to harm them. You won't get in trouble. And worst case scenario is it's not affecting what the actual cause is. So somebody else says, these symptoms all look like heart failure. How do we tell the difference?
That's a great question. So sometimes it can be really hard to tell the difference. If somebody is, maybe having another medical condition or if they've overdosed. And so sometimes if we don't know the individual, it's definitely important to call 911 right away and just get help on the way, because regardless of what they're experiencing, it's definitely an emergency type situation. And going back to what Micheline was talking about, if you don't know, it is better to administer Narcan. So if somebody is having a heart attack or heart failure or some other condition, and you are to administer intranasal Narcan to them and they're not actually overdosing, it's not going to cause more harm to the individual. So sometimes it can be difficult to know, like especially if somebody has underlying condition, but very, very important to treat an overdose if you see those signs.
Thank you. I do work with Coast Life Support District, and we've been told by some of their paramedics who we provide training with that when they are unsure of somebody who's unresponsive, they always administer Narcan for that exact reason, because it won't hurt the person. Okay, so the next one is, if they seem to die or appear dead when you arrive, do you still give them a dose?
Yes, I would say still give them a dose. Sometimes an individual can be unresponsive and they haven't been breathing. You can, obviously check for a pulse and see if an individual has a pulse using, the basic life support methodology of checking a pulse and assessing for somebody's breathing. But again, there's no harm in administering the intranasal Narcan. So, you're going to call 911 right away, and administer the intranasal Narcan, and then stay with the individual. And again, if you don't see a response after that 3 to 5 minutes, administer another dose. It's not going to cause any additional harm to the individual.
Thank you. There's lots of really good questions. The next one, before I ask the next one, I just want to address, there is a comment from one of our viewers who says that sometimes when you give Narcan, the reaction from the person, if they were experiencing an overdose and the opioid has now been removed from their receptors because of the Narcan, they might come out of their overdose really irritated because what you've essentially done is remove the opioid from their system. So one of the things that we like to tell people is that there's a chance that when people come out of an overdose after administering Narcan, they can potentially be confrontational. And that's because you've put their body into immediate withdrawal. You've now removed the opioids from their receptors. And so it's important to be aware of that. So if that happens, just stand back. Don't create a situation where you're requiring that someone stays there. So there's a chance that if you administer Narcan, somebody might get up and run away before 911 arrives. If that happens, you've done your job. Good for you. Don't try to detain somebody after that. So the next part is, next question, should you also start CPR if a person isn't breathing?
That's a good question. So based on on an individual not breathing, if you feel comfortable initiating CPR, you'd obviously be checking for a pulse to identify if you also need to do just chest compressions or just rescue breathing. So for somebody who is really not breathing, rescue breaths can be really, really important. And that's a little bit outside of the scope of the talk today, but definitely something that is encouraged if you feel comfortable providing rescue breaths.
Thank you. And this is a really great question because it deals with the environment around the person who is overdosing. And so overdoses can be in the forms of pills and or injections. And that's a question. What would you expect to see around the person?
Yeah, that's a great question. So it can be in the form of pills or injections, injectables. Pills can be laced with fentanyl, like we talked about, or even prescription opioids are extremely strong. And so an individual can easily overdose on pills, prescribed or illicit, illegal type counterfeit pills, and also injectable formulations. If you are to come across somebody, I think the question was, what would you expect to see around the person? So depending on, what the individual had in their possession, it could be residual powders, it could be needles, it could be an empty pill bottle or partially used pill bottle, a bag of pills. It could be nothing if they've taken all of the pills. So it really just depends on the situation, but it's a great question and trying to kind of understand more about what you might expect to see. It could be a variety of things depending on the scenario.
Thank you. I think that's an excellent question because oftentimes and they teach you this in CPR, you assess your surroundings first to understand whether or not the person may need CPR. So you would do the same thing here. That's a really great question. But regardless, as we've talked about, if you suspect overdose due to the signs that are presenting, then administering naloxone or Narcan is the most important part. All right, so it looks like we have cleared the question queue. I want to thank everybody who's been here today. We did go over time a little bit to answer all those questions, so I hope that everything you had wondered has been answered. And if not, feel free to contact Mendocino Health with any follow-up questions. And we are happy, again, to supply you with a free box of Narcan to keep either in your home or in your vehicle. And also just a heads up that if you are somebody who has a senior in the home who's taking medications, either temporarily or long-term for pain management, if you have teenagers in the home, if you have pets in the home and there are prescriptions in the home, these are all really great reasons to carry Narcan. So thank you for your time today. Thank you so much, Emily, for such a thorough job. And we look forward to seeing everybody at future education workshops. Everyone have a great day.